we have a help desk, and all the nurses or any floor just calls the help desk, and then they send whatever vendor needs to go. Today, we had really a minor amount of problems with equipment. We did have some elevator problems, and Otis fixed them. And that's why, you could just jump on it like that and get it fixed right away. That's why in a new building with all this new equipment and all these new staff, you want to have your vendors here. Now, maintenance, of course, is all here. Biomed is all here, and they're responding. Most of the calls to the help desk generally are minor little things. I call twice because the handsets that the patients use for the TV and the nurse call weren't working properly, and they just bring a spare and unplug and put in a new one. Little things like that.
Do you see the need? You said you have that set up for a week.
Yeah, a whole week. Yeah. Yeah, because all of us are kind of new employees this week. Now, they've all been oriented. They all came out here, did walkthroughs. They were all trained. We did as much training as we could there, John. For example, the new hospital beds. We brought in, I think, 8 beds. We trained them there. But still, when you hit people with all this new stuff, you can't retain everything. And so they'll forget some things, and we'll dispatch people from the help desk to just help them. They'll pick up their speed throughout the week. They're actually, when I was observing, they're doing amazingly well.
Did you have a lot of families come to visit people really early in the morning, or are they
No, families were very cooperative. We advised them to not come over here before the patient did, to be on that side. And then when they come over here, to come to, we have a hospitality room right down the hall here. And we had people that greeted them and then took care of them. And then when their loved one was brought over, we just took them upstairs to the room. And that went very smoothly, and the families were great.
Now that it's over and you see how it went, and you said you have 3 hospitals here observing, is there anything that you would have done differently, and maybe that you would recommend to these people coming, if you had to do it again, any little things that you would have done differently?
No, I can't think, Jeff. Anybody? No, to tell you the truth, I tell you, I just can't. It's gone so smoothly, much more smoothly than I thought, and most of us thought it would go. And I really don't have any suggestions there. Maybe when we're going to meet, the management team will meet. We'll go through everything. Maybe some things will come up, but every day this week, the management team will meet in the morning, first thing, and we'll have a little list, what we call punch lists, just little things that need to be addressed.
How soon did you realize that you would be done a lot quicker than you thought you would?
Oh, probably around 9 o'clock. You could tell by how many patients were coming over. We have a automated tracking system that's on every computer, which was essential, which our IT department built. And it had every patient in every room, and it had different colors, for whether they were in the old hospital, in transit, in an ambulance, or here, and it had their beds. That also is available to our doctors and our clinical staff, so they know where their patients are. And all of us use that tracking system. That keeps people off the phones, so everybody can keep working, because everybody's got computers, and you just look it up. And that way you know where every patient is at every moment. And there's also messages if there's anything we need to know. And that's where I could follow. That's where I knew by 9 o'clock we were going to be done before noon. We were actually done by 11. But that tracking board, which our IT department built, now there's something I would suggest to every hospital. You have to have an automated tracking system. That way everybody's looking at the same information. Cuts down on the confusion and communication.
We've talked a lot about staff here and the move and things like that. Did you coordinate with the physicians to handle rounds any differently? Did you have them here? Was it up to them?
It's really up to them, John. We've been communicating with them, of course, throughout exactly, what we're doing to their patients, and probably a little bit more in the cases of like surgery, a little more coordination there. Well, one of the things that's essential is we stopped elective surgery on Thursday night, so we could concentrate on moving surgery on Friday. That's a huge department. We did do, I believe, 4 emergency cases Friday night, but we only had, I think, 1 on Saturday, one or 2 on Saturday. But we've been set up on both ends with 2 rooms on both sides for any emergencies. And we still are. Well, we're not over there anymore. We've shut down over there. Anything now that's needed, emergencies, heart caths, any surgeries, delivering babies, anything now will be done here. And we're fully staffed here, and we're at a normal. In fact, more than normal for a Sunday. And that's the other thing you do, obviously. I mean, you know, you build redundancy and you overstaff just to be safe, which makes it a little easier.
Now that you've moved to hospital, what's the next big project you guys have?
For me? I'm tired of this one. I think we should tear it down, build another one. No, we're probably out of money, John, so I may have glorious ideas, but the board and the chief financial officer here will probably restrain me for a while. But we'll be concentrating now, John, really starting tomorrow on operations. There's a number of new systems, and we'll just be really concentrating for a while, making sure it's going smoothly, getting the bugs out. Of course, the things that we're always doing, like recruiting doctors, you know, that continues. That hasn't faltered. We'll keep recruiting doctors and developing our programs, working with the university.
Since you mentioned that, how's that coming?
It's going pretty well. We have a new urologist starting on December 1st. We have very close to committing a couple of GI docs, gastroenterologists, for next summer when they get out of school. We have 3 new obstetricians starting in November, and midwives. 2 midwives and 3 LBs will be starting the new program. We're doing that jointly with the University Medical School. That'll be in that building connected to the hospital here. We already know of at least probably 3 family practitioners and a couple more internists in primary care that'll start next summer. We're working pretty hard on urology. We need more urologists. That's probably our major focus right now. They're an extreme shortage in the country. They're hard to come by, but we're recruiting as hard as we can. It's very competitive for some of those subspecialties.
Do you think this new facility makes it more attractive?
Oh, absolutely. I can tell you when we have been recruiting, and I brought candidates in the last few months, and they walk through here, their mouths drop open. And I've had residents that we're talking to that are in major medical centers around the country. I had one quote say, "I never saw a hospital that looked like this." So, and they're impressed, and that distinctly helps because they know you're serious. They know it's a facility that's dedicated to doing things correctly, and that helps in recruiting. No question.
And do you think you can give us just, tell us a little bit about how this new facility is going to improve healthcare, just for the folks in the area?
Well, really it goes across the entire facility in all our departments. On the inpatient side, just for example, that all the rooms are private. Now, I'm already seeing that from the patients when I was talking to them this morning. The quiet, the privacy, the infection control, all those things versus those semi-privates that we have. We've redesigned our registration system and our diagnostics for outpatients since that keeps growing, so that it's very quick testing, so patients can get in and out of here quickly, very simply for outpatient testing. Our cancer center has been totally revamped.